Hello, class, and welcome back as we continue our discussion on communication, professional communication. And in this case, we're going to be looking at, in this part of our lecture, we will look at shift communication as well as some ethical considerations in documentation. So let's start off by looking at shift communication within the context of social and community service work. Shift communication and shift documentation is an essential component of providing high-quality care for our clients. Effective communication between shifts can improve client outcomes, enhance collaboration among staff, and ensure that all members of the team are on the same page regarding client needs and goals. Now, in this lecture, we will explore what shift communication is, why it's important, and provide some specific examples of how to implement effective shift communication practices in the social and community service work setting. So let's start off by looking at what is shift communication. Well, shift communication refers to the process of transferring information between staff at the end of one shift and the beginning of another. And this includes sharing important updates about client needs, changes in care plans, and any other relevant information that may impact client care. And so shift communication is particularly important in social and community service work where clients may have complex and evolving needs that require a collaborative and coordinated approach from the care team. So, why is shift communication important? Well, effective shift communication is really essential for providing high-quality care for clients. By sharing information between the shifts, staff can ensure that all members of the care team are aware of changes in client needs or care plans, which can help prevent errors and misunderstandings. Additionally, effective shift communication can enhance collaboration among staff. It can improve team morale because you know what's going on, and it helps to build a sense of trust and mutual respect among colleagues and between the professionals and the clients. So let me give you a little bit of an example of effective shift communication. Now, there are a number of strategies that social and community service work organizations can use to ensure effective shift communication. One way would be what is known as the structured handover meeting. Now, a structured handover meeting is about providing an opportunity for staff to come together to share information about client care, to review any changes in care plans, and address any concerns or challenges that may arise. And these meetings should be scheduled at the beginning or end of each shift to ensure that all staff have an opportunity to participate. There's also what is known as communication logs, and communication logs can be used to track important information about client care, including changes in care plans, medication schedules, or any other relevant updates. And these logs can be easily accessible to all staff and should be reviewed at the beginning and end of each shift to ensure that all members of the care team are up to date. There are also some mobile apps that can be used. And some social and community service organizations use mobile applications to facilitate this shift communication. Now, these obviously need to be secure and confidential, but they can be very useful for communicating among staff. These apps allow staff to share important updates and information in real time, which can help to ensure that all members of the care team are on the same page regarding client needs and goals. Now, we can get some insight from research literature on this, particularly from hospital settings and nursing, because they really do a good job with documentation in nursing. Now, research has shown that effective shift communication can have a positive impact on client outcomes. It can have an impact on staff morale as well as on organizational culture. And a study published in the Journal of Nursing Education and Practice found that structured handover meetings were associated with a decrease in errors and an increase in staff satisfaction. Similarly, a study published in the Journal of Health Services Research and Policy found that the use of communication logs were associated with a decrease in hospital readmissions. So, in essence, effective shift communication is essential for providing high-quality care for clients in the social and community service work setting. And it isn't an add-on, it is part of the job. And so by using strategies such as structured handover meetings or communication logs and mobile apps, organizations can ensure that all members of the care team are on the same page regarding client needs and goals. And the research has shown that effective shift communication can have a positive impact on client outcomes, staff morale, and organizational culture. And by prioritizing shift communication, social and community service organizations can improve client care and enhance the collaboration that goes on between staff. A structured handover meeting, as I already mentioned, is a shift communication designed to ensure that important information is effectively communicated between staff at shift changes. So in order to maintain continuity of care for the clients, it's valuable to have these kind of structured handover meetings to ensure that all staff are informed of critical information relating to the clients that they are responsible for, including any changes in the client's condition or to their care plan. Now, something that might go on for example, in the healthcare industry would be, as part of the structured handover meeting, is what is known as the SBAR method, which means that they look at the situation, they describe the background, they include an assessment and a recommendation, hence the SBAR, the situation, background, assessment, and recommendation method. And this method was, while it was originally developed for use in the healthcare industry, but it has been adopted in a lot of other industries, including social and community service work. And the SBAR method provides a framework for communicating important information in a structured, concise manner. So in a structured handover meeting using this SBAR method, the staff members involved would follow a specific format for communicating this information. So in the situation portion of the SBAR method, that involves providing a brief overview of the client's current status and any pertinent information that has occurred during your shift. And this might include changes to the client's physical or mental health status, any incidents or behaviors that have occurred, any medications or treatments that have been administered. Then comes the background portion of the SBAR method, which involves providing information about the client's history and care plan. And this might include details about the client's medical history, current medications, allergies, and other information. Then there's the assessment, and this is the process of gathering and evaluating information about a client's situation to identify their strengths and their needs. And the assessment process is critical because it helps the social service worker to better understand the client's situation and tailor services to meet their unique needs. And the information gathered during the assessment process, it can be things like their demographic information, mental and physical health, their education, their employment history. Now, you need to kind of be mindful what's appropriate for the overall documentation versus what is for shift communication. And then recommendations. The recommendations is part of the documentation should include specific and achievable goals that are developed based upon the assessment information. And these goals should be tailored to the client and their needs and circumstances, and should be developed, of course, in collaboration with the client. And the recommendations should be concise and clear and should include some specific goals that need to be taken, specific actions that need to be taken to achieve the goals that are stated. Now, when developing recommendations, it's important to take into account the client's culture, their values, and their preferences. For example, if a client comes from a culture that values community and family support, it may be important to include recommendations that involve family or community members in the client's care. Similarly, if the client has specific religious or spiritual beliefs, recommendations should be tailored to respect these beliefs. And overall, the assessment and recommendations sections are critical components of social service documentation. They provide a framework for understanding the client's needs and developing a plan to support them. And by ensuring that these sections are clear and concise and tailored to the client's needs and circumstances, social service workers can improve the quality of care provided to clients. Now, as I mentioned before, there are also some mobile apps that can be used that are specifically designed for shift communication in the social and community service settings. And I want to just kind of highlight a few of those mobile apps that can be used. One is known as CareZone, and this is a mobile app that allows providers to communicate and share information about their patients and clients. And with CareZone, healthcare providers can create a list of patients and share it with all the members of the care team. And the app also allows users to create to-do lists and set reminders for tasks. Then there's Staff Link, so it's Staff Lin with a Q. So Staff Lin Q is how it is when you say it's Staff Link. And this is a mobile app that is designed for use in the hospitality industry. However, it can be used in the social and community service setting. And the app allows managers to communicate with their staff and assign tasks. And staff members can also use the app to view their schedules and request time off. Then there's something known as Shift Note. And Shift Note is a mobile app that's designed for shift communication, again, in the restaurant industry. However, it can also be used in the social and community service setting. And the app allows managers to create schedules, assign tasks, communicate with their staff, and the staff members can also use it to communicate back with the managers. There's also something called Slack. And Slack is a popular communication app that can be used in the social and community service setting. Now, with Slack, users can create channels for different teams or projects, and they can then communicate in real time. And the app also allows users to share files, send reminders, and create to-do lists. And finally, there's something known as Trello. And Trello is a mobile app that is designed for project management. However, it can also be used for shift communication in the social and community service setting. And the app allows you to create boards for different projects and add tasks to each board. And so users can also assign tasks to other team members and to set due dates. So overall, mobile apps for shift communication can be useful in the social and community service setting because they allow for some real-time communication between team members. And this can be especially important when quick decision-making is necessary. And so mobile apps can help to streamline communication and reduce the need for paper-based systems. Now let's go on and explore a little bit of the ethics of documentation, because ethics is a critical consideration in the social and community service setting, particularly when it comes to documentation. Now, documentation is an essential part of client care, but it can also raise ethical concerns. As social service workers, it is important to ensure that our documentation practices are in line with the ethical principles and guidelines. And so there are some certain rules that need to be upheld, particularly in documentation in the social and community service setting, that provides some specific, and I want to provide some specific information about the ethical standards. The first one is documentation of client care in, say, for example, a counseling setting requires that you hold on to it, normally in most regions, for 7 years. And it needs to be secure and locked. And so this information is around for a long time. But it can also be very sensitive information, so it needs to be confidential. And so one ethical principle that is particularly relevant to documentation in social and community services is confidentiality. And confidentiality refers to the obligation to protect sensitive information about clients and to limit access to this information to those who have a legitimate need to know. And so it is essential for social service workers to respect a client's right to privacy by maintaining confidentiality at all times. And in the context of documentation, this means that social service workers may ensure that clients' personal information is not shared with individuals who do not have a legitimate need to know. For example, if a client's medical information is included in their file, it should not be shared with anyone outside of the medical team involved in their care. Social service workers must also ensure that electronic records are secure and that physical records are kept in a locked and secured location. Another ethical principle that is relevant to documentation is the principle of informed consent. Informed consent refers to the process of ensuring that clients understand the purpose and nature of their involvement in social and community service, as well as any potential risks or benefits of their involvement. And so clients have the right to make informed decisions about their care, and this includes decisions about their involvement in documentation. So, what have we learned? Well, we've delved into the critical topic of documentation in the social service and community service setting. We began by highlighting the importance of proper documentation and how it can lead to better client outcomes, how it improves decision-making and reduces legal liability. And we've discussed the importance of shift communication and how it can aid in maintaining continuity of care. We then moved on to discuss the different types of documentation that are important in the social and community service setting. We looked at assessment recommendations, progress notes, incident reports, and discharge summaries. We also discussed how to write effective documentation, ensuring that it is clear and concise and objective and accurate. Next, we explored the ethical considerations of documentation. And we've given some thought to ethical principles such as confidentiality and informed consent. We also need to be mindful of the respect of the client's autonomy in this whole process of care. We looked at some examples of all of these things. And we've discussed how to use mobile apps for shift communication and how they can be useful in enhancing communication and collaborating with our team members. In essence, the key points of this lecture are that proper documentation and shift communication are critical to providing high-quality care in the social and community service setting. The different types of documentation that are important include, but aren't limited to, assessments and recommendations and progress notes and incident reports and discharge summaries. And some ethical considerations that are crucial when documenting client care are things like confidentiality and informed consent. Now, I hope you've enjoyed this lecture and found it very informative. And I will see you as we go on with our next lecture. So I'll see you later. You take care. Goodbye.